Dear friends, so far we have come to a stage where we have drawn up a protocol, and it's now left to us to make this official with the authorities concerned and conduct a study. This is a short module where I'll go through the basic steps that we have to tick or make sure that we have done all this before we actually conduct a study. The study protocol has to go through the ethical committee for approval. Without ethical committee approval, it is incorrect to do a study in any institution. Many institutions also have a scientific committee who will basically look at the scientific veracity. In our hospital, for example, we put our protocols through a scientific committee, and after making modifications, if any, we put it to the ethical committee for approval. We also have permissions from the institution, which is basically automatic after the ethical committee has approved it, and the HOD has to approve the study in any institution, and I'm sure this would also be a formality. What is important is to go to every consultant or every unit head in your institution and get his permission to make use of the data which are coming from his patients or the patients in his unit. This is many times done verbally, but some institutions may want to have a formal written permission from the unit heads. I have mentioned about informed consent before, and we're going to mention it again because this is an area where most of us are very lax, and it is incorrect to be lax. You have to explain the process of the project to the patient, give them time to read and understand, answer all their questions that they may have, and get a signature of the subject and the signature of a witness. I repeat, as I've said earlier, that you must give them the choice of not participating and make it clear to them that at any time during the process or during the project, they can withdraw their candidature without assigning any reasons. You may also want to register with the CTRI, the Clinical Trials Registry of India. I haven't done one myself, to be honest, even though I have read up about it, and one can get more information from this URL. It's ctri.nic.in. There is a very nice e-tutorial in the home page of this site which tells you what it is all about and how you go about registering yourself and registering the study that you're going to undertake. This is the e-tutorial I was referring to. It has several segments and it is self-explanatory. I can tell you that it is reasonably easy to do it, but I must add that I haven't registered any of our trials with it so far. It is said that registration of all trials is mandatory, but I presume it applies mostly to drug trials where after the trials they're going to approach the government for their approval to clinically use a given drug. But nevertheless, I think it would be a good idea to start registering with the CTRI. The data that you collect will be on a master sheet, which is a hard copy. Nowadays, we hardly use a hard copy. We go on to a spreadsheet, which is a soft copy. You can either use an Excel, Microsoft Excel. One of my favorites is Google Sheet, which is on the cloud. One of the advantages is that if you share it with your partners or with your fellow researchers, then that sheet can be seen in real time. All the changes can be seen in real time, and you don't have to keep on sending the new spreadsheet by email each time you change it. The documents that you use the spreadsheet must always have all the demographic details, the investigation details, and the interventions details. And there may be several data points for each of these subheadings, and all of them must figure in your spreadsheet or the master sheet. The primary and secondary outcomes are also to be recorded, and if there are subgroups, it would be very easy to have one master sheet and then create several subgroups as the need may be when you have an electronic spreadsheet. I will not go into how one does it, but believe me, it is a different story when you have a soft copy compared to when you have all the data on a hard copy or a master sheet, which we used to have before the days of computer. So I strongly recommend that you collect all your data on a good spreadsheet. Data analysis, I think it is sometimes difficult to do everything by yourself. It's good to co-opt associates for data collection. Make sure that they are diligent, honest, and are very clear and disciplined in collecting data. You may have to liaise with partners and other units, with the laboratory, and it's always good to have a system to double check the data collected. It must be done on an ongoing basis. You keep looking at it every week, and you must have a more detailed look at the data every 4 to 8 weeks. You may even do an interim analysis or a kind of analysis of your data in between when you have, say, 20% of your subjects' data collected. If you have any recruitment difficulties or difficulties in data collection, you can sort it out at that time. And you find that if you have difficulty in the feasibility in the collection of data, while you are not allowed to change your protocol, you are allowed to recruit more partners and more associates to help in collecting the data. Of course, interim analysis will help you give the trends, and in the more serious drug trials, for example, in an interim analysis, if a drug, experimental drug that's being used is known to give a lot of side effects, you can even abandon the trial. And of course, an interim analysis may also show up unexpected results, in which case you may have to take appropriate corrective action in the conduct of the study. At the end of the study, you complete your data collection, analyze deviations if any, and see how well you can incorporate all the data that you have. Remember that you cannot exclude patients and you have to stick to the intention to treat basis of calculations. Conclusion is based on analysis, which is essentially screened by a statistician, because as surgeons, I do not think the large majority of us have the knowledge of statistics to be really objective and correct in a statistical analysis. Once you have the analysis data, you come to conclusions. As I keep saying, conclusions cannot go beyond the data that you have. It's one of the commonest mistakes most of us do. So you must stick to a data which gives you the basis on which you make the conclusions, you come to the conclusions. You then present the data at a conference and later on write a paper about it. This basically is in a nutshell as to how you conduct a study. This brings us to the end of module number 9. Thank you.